Hi, everybody, and welcome and thank you for having me. Just a real brief thing about myself. I've been a family physician for 15 years. I'm a graduate of the Altman residency program. I'm currently the program director, so my job is to train doctors who go through my residency program, and they do a 3-year training program with me in order to be able to practice on their own. And one of the things that I see as a family physician a lot is allergies. So I do want this to be informal. Please feel free to interrupt, or if you'd like to save your questions to the very end. But I'm going to tell you everything I know about allergies, and I have allergies, so I can relate, and I think that maybe some of you do too. We'll talk about the different types of allergies. We'll talk about when you should get allergy testing. I get asked about that a lot. When should I check for allergies, or should I? Then we'll talk about how to treat and manage your allergies, and then know what to do in a really severe allergy situation. And that term is called anaphylaxis. And when you hear the term anaphylaxis, that's a really severe version of an allergy that is potentially life-threatening. So we'll go through some of the more common types of allergies, and the main one that a lot of people have is called allergic rhinitis. And allergic rhinitis is sometimes called seasonal allergies, but it doesn't have to be seasonal. It could be all year round. And we'll talk about what that means and what does allergic rhinitis means. Some people call it hay fever. That's a type of allergic rhinitis. We'll also go through some of the food allergies, some of the more common food allergies. And there's been some really neat, life-changing studies that are now rethinking how we deal with food allergies, including the scary peanut allergy. Then we'll talk about medication allergies, especially antibiotics. There are a lot of people. There are a lot of people who are allergic to antibiotics like penicillins, and that makes it hard on us. We have patients who come in and they have allergies to almost every antibiotic, and now they're in a situation where we have to give them an antibiotic, and we're not left with many options. So there is a way around that, and we'll talk about medication allergies, and then the dreaded anaphylaxis. This is what kills people, and this is probably the thing that scares us as physicians the most. So we'll talk about allergic rhinitis to start. Rhinitis really means inflammation of the nasal passages. So in our nasal passages, we have a lot of tissue, and if that tissue gets inflamed, then it can cause a runny nose, sneezing, itchy, watery eyes. And when we have people who have seasonal allergies or year-round allergies, this is the area that gets affected the most. So what are some of the allergic rhinitis symptoms? Well, I mentioned runny nose. People complain of nasal congestion, sneezing, itchy nose, and then they have itchy, red, and watery eyes. Sometimes this almost looks like pink eye. Sometimes the eye allergies are so severe that it can confuse doctors into thinking that it's pink eye when it's actually not an infection. It's just an allergic reaction. I've had some patients who complain of itching at the top of the roof of their mouth. I've had some patients who have itching in their ear canals, and they want to take the end of a pencil and go in there digging. I don't recommend anybody do that, but people want to get relief from that itching, and it's almost in a place where you can't reach. Then there's this term called postnasal drip, and this is where the drainage goes to the back of your throat. And if you're ever in a situation where when you lay down in bed and you start coughing, that is probably postnasal drip. It's probably drainage from your sinuses to the back of your throat and triggering a cough. And some people will mistake that for asthma or for a virus, but it's actually allergies that's causing that, what we call nighttime cough. In kids, allergies actually present a little bit different. We've had some kids who went from being straight A students to C and D students And because all of a sudden in the spring or fall, their allergies started acting up. And they felt tired all the time. They had trouble sleeping because they were coughing or they were congested. And during school, they were so tired that they had trouble focusing. So we have kids who come to us and their parents are wondering what in the world is going on. They were doing so great at the beginning of the year, and then all of a sudden in the fall, their grades started dropping, and that may be allergies. So we do a very thorough exam to make sure that we're not missing something as simple as allergic rhinitis. Who gets it? Well, about 20% of people of all ages, and the risk is much higher if you have a history of asthma or you have a personal history of eczema. So if you have dry skin or asthma, you are at much, much higher risk of having allergic rhinitis. Similarly, if you have a family history of asthma, so if your father has asthma or your mother has eczema, or they both have allergic rhinitis, even just having one parent with any one of these increases your risk. And the reason why is because asthma, eczema, and allergic rhinitis are all on the exact same gene, and they can be transferred from parents to children through that one gene. Now, just because your father has asthma doesn't guarantee that you will have asthma, but it does increase your risk of one of these three things. Allergic rhinitis can start anytime, but often starts in childhood. And what's weird about it is it waxes and wanes, which means that it can come and go. You can have a really great spring one year, and then the very next year have a really bad one. And you can develop allergies at any point. So I have patients who say, it can't be allergies because I've never had it before. But that's the most common way it presents in people who've never had it before. And so please remember that you can develop it at any time. It's one of those things that surprises people when they get it. And it's not a good surprise, of course.
So Dr. Musa, someone had a question in the chat that says, is it common for people to be allergic to scents in the home, like those with wallflowers by Bath and Body or scented candles?
Very common. Yes, I'll definitely talk about that. I'm sorry, I don't have the chat open.
That's okay. I can help you with that.
Thank you. So yes, anything that gets aerosolized, so anything that ends up in the air, the first time you come in contact with it, you might have no problems at all. But the second and third and every time after that, you can certainly develop allergies to it. And so patients will also say, I can't be allergic to tree pollen because I've never had a problem with tree pollen. But that's exactly how allergies form. They develop because you've had multiple exposures. Why do some people get it and others don't? It's really hard to tell. A lot of it is genetics. But if you find that you're sneezing, coughing, having a runny nose around a certain perfume, it's almost certainly related to an allergen, to that allergen. So what are the seasonal allergies? The seasonal allergies are tree pollen, grass pollen, and weed pollen, but not flowers. So why aren't many people, if any people, why aren't they allergic to flowers? And the reason is that flowers, plants make flowers to attract insects, like bees. And so flowering plants have very heavy, sticky pollen that gets carried by bees from flower to flower. That heavy and sticky pollen is not in the air. And if it's not in the air, then you're not exposed to it. And if you're not exposed to it, then you don't develop allergies to it. Now, there are some people who are around flowers like roses and tulips and daffodils so much that they develop an allergy, but it's fairly unusual for those who aren't in contact with roses and tulips and daffodils often. Now, the perennial means year-round. The perennial allergies include dust mites, cockroaches, molds, and animal dander. And it really doesn't matter if it's hair or fur, if it's a shedding or non-shedding animal. It doesn't matter if it's a poodle or a schnauzer or a Portuguese water dog or a Siberian cat or any of the hypoallergenic pets. They still have some shedding. There's still some exposure. and you can become allergic. Even if you've had that same pet for 15 years, we've had patients who develop cat allergies, even though they've had the same cat or same pet for years, and they'll get upset at me when I tell them that I think it might be the cat dander allergy, because how could it be? They've had the same cat for a while, but that's exactly how it develops, and that's something a lot of people um, don't always understand, that the prior exposures is what puts them at risk. So dust mites.
So there was another question. I'm going to interrupt you really quick and just say, what genetic gene connects eczema and asthma? I think you had talked about on a couple slides back.
I do think I have a slide on that.
Okay.
Yeah.
We'll
Sorry.
hold all the questions then.
Oh, no, that's okay. I don't mind. If I don't, please remind me. I'll be happy to answer.
Okay.
Dust mites are almost microscopic insects that live in the beddings and the sofas and the carpets and other woven material. They really like moisture, and they're pretty gross to look at. Under a microscope, this is how they look. They don't bite. They're not like bed bugs. They're way smaller than that, and they're not actually harmful to us, but they do trigger an allergy and trigger allergy symptoms. So I have patients who every time they vacuum, they get an allergic reaction, and it's not to the dust. It's actually to the dust mites that they're getting this reaction. So I always recommend that they don't do the vacuuming, and if they can help it, that they even replace the carpet with something like a hardwood or a laminate. And I know that's not always possible, but if they can get somebody else to do the vacuuming, or if they can get a vacuum that has a special HEPA filter, that can really make their lives better. So what about the tree pollen? What about the allergens in Ohio? Well, tree pollen shows up in May. So most people do great in January, February, March. In late April, you start to see a peak of tree pollen. And then that comes down in June. So tree pollen is the very first type of allergy that people get in the spring. In June, now we deal with grass pollen. So the tree pollen is done, and now grass pollen is starting to increase. So we have trees in May, grass in June, and then we get a break in July and August. So in July and August, there's no pollen. Most of the trees are now somewhat dormant. The grasses are now dormant. And then September hits, and we're in weed pollen right now. So weed pollen peaks in September, and a lot of people have this 2-month period of time where they had no problems and now develop allergies again. So please remember that that the fall pollen or fall allergies are related to weeds. What to look for? Well, in little kids, we might see what we call allergic shiners. These are really bright red areas under their eyes. They almost look like they were hit or punched. Of course, that didn't happen, but sometimes it's so severe they get bruising. And then kids do this thing called the nasal salute. If you ever see if anybody has kids, you'll know that to wipe their nose, they'll do that. And they do it so often that they develop this crease here right above their nose. That's a telltale sign that this child has allergies. So who should get allergy testing? Not everybody. There are some people who know exactly what they're allergic to and don't need allergy testing to confirm it. But if your symptoms are really severe, you might want to do allergy testing, because allergy testing can help us figure out how to treat it. We might do allergy testing if you fail medications. So if we've tried you on some medications and you're still having symptoms, then it may be worth doing allergy testing. We should also do allergy testing if we have no idea what you're allergic to. So you did everything you tried to do to keep track of what you've been exposed to, and we still don't know. And if that's the case, then allergy testing would be right for you. why do we do it? We do it to determine if you really do have an allergy. We do it so that we can try to control your environment. Because if we know that you truly have a cat allergy, then maybe we do something about that. And we'll talk about what you can do. Why do we do skin testing? We do it so that we can get the exact right mix for your allergy shots, and we'll talk about allergy shots in a moment. And then we also do allergy testing to determine if you're at risk for the dreaded anaphylaxis, that life-threatening allergic reaction. So how do we do allergy testing? There's actually 3 ways. One is with skin testing with little tiny needle injections, and they inject you with the thing that they think you might be allergic to. So this person is allergic to feathers, cats, dogs, horses, but not sheep wool and not mold, and actually allergic to everything else. So we can tell here exactly what he or she is allergic to and what things to avoid. You can also do allergy testing with patches. So this does not include needles. It includes this almost like a sticky large bandage that goes on your back, and we keep it on there for several minutes. And then after several minutes, we take that off and we look to see what you reacted to. And if you develop a reaction to any one of these, we can tell what that allergen was, because we've numbered every single one of these patches. So this is not as reliable as the injectable one, but it works well for people who hate needles and don't want to have anything to do with little tiny injections. So we have the skin test with injections, skin test with patches, and then we have this blood test. And this blood test is a simple blood draw, just like you would have your blood drawn for your cholesterol or your sugars. So they take the blood from your veins, and then they test it against many of the common allergens like peanuts and soy and wheat and eggs and cow's milk. And it can tell us exactly if your allergy is a very high allergy, or if it's a low or moderate, or if it's below detection. If it's 0, then you know you're not allergic to it. So for example, this person is not allergic to rice, but they're really allergic to soybeans and oats and green peas. So this can tell us a lot. So you might be wondering, why in the world aren't we doing this for everybody? It looks really fancy. And obviously the risk or the problem with the blood test is that it's more expensive, that the turnaround time is days, not minutes. See, the skin testing, you get a result within minutes, whereas the blood test could be days or weeks. Also, the results aren't visible to you. So if you could see a reaction on your arm to cat dander, then it convinces more people that, okay, this is real. I'm really reacting to it. I should probably take this seriously. Whereas the skin test, whereas the blood test, you just don't see it. There's nothing visual there. The skin test is inexpensive. It's really cheap. The results are visible, and the turnaround time is very quick. So how do we treat all this? Well, we can use antihistamines, and it turns out that all of these are now over the counter, but there's a prescription version for all of these. Claritin, Zyrtec, and Allegra are the more common ones, and there's a few others that are a little less common, like Clarinex. Then we have the immune system medication. So Singulair is the only one in this class where it actually calms down your immune reaction to it. And Singulair is sometimes given to people with asthma. And why? Because people with asthma and seasonal allergies respond very similarly, because they are on the same genes. And then we have the nasal sprays. not just any nasal sprays. This isn't like saline. This has a steroid in it. And you may have heard of Flonase and Nasacort. These medications work really well. In fact, steroid nasal sprays have been shown in studies to be superior, so they're better than antihistamines. Most people don't like to spray their nostrils daily, and it only works if you take it daily. Actually, all of these only work if you use them every day. This isn't something that you use just whenever you feel like your symptoms are developing. It won't work that way. So I always encourage my patients to use it every day during your seasonal allergy. So if you happen to have tree pollen allergies, then early spring is the time to do it. If you happen to have weed allergies, then you want to do that at the end of during September. Okay, so how do we control our environment? This is always hard for patients to hear, but sometimes it means, especially if your reaction is so severe, sometimes it means that you should find a new home for your pet. People won't listen to that, of course, so at the very least, you should keep your pet outside of your bedroom. As soon as the pet is inside the bedroom, that makes it very difficult to clear the dander and the fur and the hair. You want to run an air cleaner, and you want to use a HEPA filter or an electronic filter, but not an ozone generator. So HEPA filters, they filter very tiny microscopic allergens, and they do a great job of it. You have to keep replacing the filter, unfortunately, but they do work. How do you get rid of house dust mites? So we talked about vacuuming and make sure it's not done by you. And if you did try to vacuum, you might not tolerate it very much because you're pulling the dust mites from your carpet and putting them in the air. Pillow encasings and mattress encasings work really well. Not just regular encasings. It has to be the type that filters or prevents allergens from going through. So there are very special allergy-specific encasings that work really well. So I hinted at that I do have allergies, and my allergies developed last year, and anytime I put my head on my pillow, my eyes would start burning but it would be red the next morning. And I wondered what in the world is going on here. And I tried a bunch of things, and I looked around in my environment and couldn't find anything, and then finally saw a pattern that it was at night that I had this problem. And I hadn't changed the pillow or anything, but as soon as I put an encasing around that pillow, my symptoms are gone. So I could have medicated myself, but finding the cause is very important. And if you can do that, then you might be able to avoid medication. Replacing the carpet with hardwood or laminate, washing your beddings. And for indoor mold, a lot of people worry about mold, and mold really isn't dangerous unless it's in very high concentrations. But truly, if you can't see it or smell it, you don't worry about it. It's not a problem. If you can see or smell it, then you should clean it up, and it should be done by a professional. So ideally, a company that does this for a living. Okay, I hinted at allergy shots, and this is called immunotherapy. And it's not a medication, it's actually like an immunization, like a flu shot. It doesn't treat, but it does prevent. And it is a long time commitment. So in some people, their allergic reaction is so severe that they have to get shots weekly and then monthly and then every other month. And you might have to do that for a while, but the results are really long lasting and can be lifelong. So it's worth it for some people. Physicians have to be present because we're giving you something that you're allergic to. That's how this thing works. They give a small amount of something that we know you're allergic to, so that's risky. It could increase your risk of having a really bad reaction. So this is why you can't just do immunotherapy at home. However, this is not a substitute for environmental control, which means that you still have to control your environment. If you have really severe cat dander allergy, then no amount of immunotherapy is going to prevent you from having a reaction if your cat is around you all the time. So we still have to control the environment, and you might still need medications, but perhaps not as much of it. So when we talk about anaphylaxis, how do people die of allergens, and what specifically? Well, the most common one is the contrast that we give patients for like CAT scans. This contrast, the contrast that you get in your veins does cause a lot of anaphylaxis and deaths. We're getting much better at recognizing it, preventing it. So this number is going down, thankfully. But a lot of people still die from antibiotic allergies. A lot of people die from food allergies and bee sting allergies. So the 8 most common food allergens are milk. So please remember, this is not a lactose intolerance. This is an allergy to the milk protein. So a lot of people think, okay, I'm allergic to milk because every time I drink milk, I get bloated and maybe diarrhea. That's lactose intolerance. That's not what we're talking about here. We're talking about milk protein allergy. People who have milk protein allergy, they get hives everywhere. They might have lip or tongue swelling. They get itchy. So that's a very different allergy from lactose intolerance. Then there's an egg allergy, peanut allergies, and tree nut allergies. So peanuts are not tree nuts. They're in a separate category. And tree nuts include like almonds, chestnuts, hazelnuts, walnuts, cashews, and things like that. Wheat is a common allergy, soy, fish, and shellfish. So the vast majority, well over 90% of food allergies fall within one of these 8 categories. So what's a good story? When a patient comes to me and says, every time I eat blank, I get blank within blank minutes. So this statement, I should be able to tell, or should be able to make the statement on everybody who has a true allergy. So every time I eat peanuts, I get a rash within 30 minutes. Every time I eat shellfish, I get lip or tongue swelling within minutes. If you find yourself saying, it's not every time that I eat peanuts that I get a rash, and sometimes days later, that's not a true allergy, okay? That's not a real story for allergy. That might be something else. Now, I did say that most of the allergens come from those 8 food groups, but virtually any food can cause an allergic reaction. And for some people, even a small amount, even a tiny amount of peanuts, for example, can cause anaphylaxis. And this is why my kids aren't allowed to bring peanut butter sandwiches to school anymore. Most schools have taken it out because they know how severe this can be. I always tell my patients to do a food and symptom diary. If we're not sure what's causing their symptoms, then we need to keep a close eye on it. What did you eat? What did you do? And what did you experience? And if they can tell me exactly how soon after the food or the medicine or the activity did they develop symptoms, that can really help us figure it out. Obviously, the treatment here is avoidance. And little kids who have severe allergies should wear a wristband. And adults should wear a medical alert bracelet. If you're ever in a position where you are not able to speak for yourself and you end up in an ambulance or in the hospital and you can't tell us that you're severely allergic to penicillin, that could cost your life. So please, if you have a severe allergy to anything, you have to identify it on yourself. The mainstay treatment for the really severe kind of allergy is self-injectable epinephrine, and we'll talk about EpiPens in a moment. Food allergies are interesting. Most people actually outgrow milk allergies. They outgrow wheat allergies, and they outgrow egg allergies in late childhood. So there aren't many adults who are allergic to eggs, but there are many adults who think they're allergic to eggs, um, and and they probably outgrew it. And most people don't actually outgrow peanut allergies or tree nut allergies and seafood allergies. So once you're allergic to peanuts or seafood or tree nuts, you're allergic for life usually. So it's amazing how our bodies can respond differently to different foods. So what do we do about peanut allergies? Peanut allergies are quite amazing. There was a study um, in the Middle East, in actually it was in oh goodness, I can't remember the country, um, where they actually tested the idea of giving peanuts to babies who are at risk for who are at risk for developing peanut allergies. And this study would never have been possible in the US because we're just not allowed to test things this dangerous on babies. And they found that families with babies who are at high risk for peanut allergies should have peanuts introduced in their diet at 4 to 6 months, which is mind blowing. And when we first heard about this study 2 years ago, we thought there's no way anybody's going to do this. And now it's the standard of care. So now, if you have a family history of peanut allergies, you should be giving your babies peanuts at age 4 to 6 months. Now, we're not talking about actual peanuts. Don't ever do that to a 4-month-old. We do it in the form of a powder, and it's a very controlled system. And the system is called Ready, Set, Food. So this Ready, Set, Food system can help babies not develop peanut allergies or egg allergies or milk allergies. And it's almost perfect. If you do it right, you're almost guaranteed to have a child who will not have a peanut allergy, even though there's a strong family history. Every parent had a severe peanut allergy. Every sibling before them had a severe peanut allergy, but they will not. So it's an incredible system, and it works, and it shocked every physician who doubted it. Penicillin allergies, many people state that they have a penicillin allergy, even though the vast majority outgrow it. So actually only 10% of people who think they have a penicillin allergy test positive for it. The other 90% test negative. And we don't know why. Was it because that they never really had a penicillin allergy, or that they had one and now they don't? And both cases are possible. We know that penicillin allergies can come and go. The only way to know for sure is to be tested. If you're sure you have a penicillin allergy and you need penicillin, you could get tested to see if you're still allergic. I have patients who tell me, when I ask them, what is your penicillin allergy? They'll say, I don't know, my mom just told me I had one. And those are the least reliable stories, unfortunately, is what we found. Okay, bee sting allergies. Bee sting allergies can occur from killer bees, bumblebees, yellow jackets, hornets, and even fire ants. They have the exact same venom. So it's amazing to think that fire ants have the same venom as a bumblebee. We always want to ask ourselves, after you get a bee sting, we always want to ask ourselves, what is the risk of having a life-threatening reaction? And as long as your lips, tongue, and throat doesn't swell, then you are not at increased risk, and you do not need an EpiPen. But if at any moment you get short of breath or your lips or tongue swell, then you better get an EpiPen now, and you better have one for later, because the next reaction is going to be almost certainly the same or worse. We do immunotherapy for bee sting allergies, and if you do it right, you can get your risk reduced to less than 5%. Imagine we can cure 95% of people who have anaphylaxis to bee stings by using immunotherapy. It's quite remarkable when it works. It does take a commitment, though. This is what anaphylaxis looks like. Blood pressure drops, they're short of breath, they're wheezy, lips and tongue swell, throat feels tight, they get hives. This is a medical emergency. If you don't get an EpiPen very soon, your throat will close up. And this is what an EpiPen looks like, and you can inject it really anywhere in the body, but they recommend the thighs, and it works within seconds. At one point, the company that makes EpiPen was overcharging, and they were charging hundreds of dollars because they were the only makers of it. But now there are cheaper alternatives, thankfully. We always have to ask ourselves, and a couple more slides and we're done. We always have to ask ourselves, when is an allergy not really an allergy? If you've ever been out in the cold Ohio winter and you found that your nose is runny, that's actually a reaction to the cold weather. And what the cold weather does is it makes your the veins in your nostrils makes them a little bit leaky. And so if you have a runny nose and that's it, no itching or sneezing or watery eyes, then it's probably not an allergy. Heartburn or acid reflux can mimic allergies. I had a patient who was sure she had allergies, but Claritin didn't work and Flonase didn't work, and we ended up doing an acid reducer like Nexium or Protonix, and it worked. So acid reflux can mimic. There are some people who get a viral infection, and then they have a cough that lingers for weeks or months after. I had a patient a year ago who he recovered from his upper respiratory infection, but never stopped coughing. And in his case, he developed what we call a habit cough. And lozenges help, and speech therapy is what he needed to overcome that. And then this is actually more common than we realize, that some people get this little rash just around their mouth, nowhere else. They don't get tongue swelling, they don't get lip swelling, they don't feel short of breath. And this happens after eating very fresh fruits or vegetables. And I'm talking about so fresh that it's right off the tree or right off the plant. We don't know why this happens. And it has nothing to do with the chemicals that they're sprayed with. But there are some kids who develop this little rash around their mouth. And how do you treat this? You actually let the fruit or vegetable sit for a day or two, and then eat it. And they can continue to eat those foods, and they can actually continue to eat them fresh if they want. It's not going to hurt them. It's not going to turn into anything bad. This is just a repeat. Do not postpone introduction of solid foods like nuts and fish or eggs or cow's milk. And really changing mom's diet during pregnancy really does not seem to help too much. We do know that breastfeeding for at least 4 months can help reduce the risk of eczema. We're not exactly sure how that works, but it does. What's coming in the future? This is the very last slide. Instead of getting shots of, or what we call allergy shots, in Europe, they're trying something called sublingual immunotherapy. So they actually put the thing that you're allergic to under your tongue. It's not as effective, but it is safer, and seems to work. So more to come. The US has been slow to adapt this. We're not sure why, but the FDA is kind of resisting this a little bit. I think they're worried that people are going to take these home, put it under the tongue, and then have an anaphylactic reaction to it. And so I think the FDA is a little weary about this.